Hi there, welcome back to my professional YouTube channel. In this video, I'll be addressing a really important question that comes up quite often in therapy. Why do I have to be involved with the treatment planning process? If you're new to therapy, or even if you've been in therapy for a while, this might be something you're wondering about, so let's dive in together. You might already know what a treatment plan is, however, please let me briefly explain. A treatment plan is essentially a map for your therapy. It's a structured outline of your goals, the challenges you're facing, and the steps you and your therapist are going to take together to help you overcome those challenges. Now, I can see why you might be wondering, why do I need to be a part of that? Isn't it your job as my therapist to come up with the plan? But here's where it gets really important. Therapy is not something that's done to you. It's a collaborative process that's done with you. You can think about it like this. You are the expert in your own life. You know your problems, thoughts, feelings, relationships, strengths and weaknesses, and experiences better than anyone else ever could. You bring invaluable insight to the table about what's working, what's not working, and what your true goals are. Without your input, the treatment plan wouldn't truly reflect your needs, and that could slow down or even hinder your progress. When you're involved in creating the plan, you're more engaged in the therapeutic process. You and I are essentially rowing a boat together toward the same destination. If only one of us is doing the rowing, we're likely going to veer off course. But when we're both actively steering the course, we're much more likely to reach your goals. It also gives you a sense of ownership, empowerment, agency, autonomy, and accountability in your progress. Another key reason for your involvement is that therapy is most effective when the goals are yours. You need to feel motivated to work on these goals. If they're not meaningful or personally important to you, it's easy to lose focus or motivation. You deserve to have a say in what success looks like for you, whether it's learning how to manage anxiety, improving relationships, or overcoming trauma. By being an active part of the treatment planning, you're able to set realistic, achievable goals that feel aligned with your own vision for your life. Now let's talk about something else, flexibility. Being involved in treatment planning allows you to regularly review and adjust your goals. Sometimes life changes, or maybe you realize that what you thought you wanted has evolved into something different. When you're a part of the process, it's easier to shift gears and make sure that your therapy continues to serve you in the best way possible. Finally, therapy is a space for you to learn about yourself, and that includes discovering your strengths, your resilience, and your ability to heal. By participating in the treatment planning, you're taking an active role in your own growth. This empowerment is part of the healing process itself. It helps you see that change is not something you wait for, it's something you co-create. Before we conclude this video, let's talk about another crucial aspect of the treatment planning process, the importance of mental capacity and informed consent. When it comes to making decisions about your health care, whether in therapy or any other form of treatment, your ability to fully understand and make choices is essential. This is where mental capacity and informed consent come into play. Both are fundamental to ensuring that you are making empowered, autonomous decisions about your treatment options. Empowered agency is at the core of this process. Your ability to make autonomous decisions is vital in creating a treatment plan that you feel invested in. When you understand the choices available to you, and you're given the space to ask questions and weigh those choices, you're not just following a plan, you're choosing the path that feels right for you. This enhances your sense of control, which can be especially empowering in a therapeutic setting where you're working through challenges that may sometimes feel overwhelming. Respecting your mental capacity or lack of, and ensuring that you give informed consent are not only ethical obligations in therapy, but they are also deeply tied to your personal growth. By being empowered to make informed, thoughtful decisions about your health care, you're exercising autonomy over your well-being. You have the right to explore all your options, to decide which interventions resonate with you, and to ultimately choose what feels like the best path forward. This isn't just about going along with the process. It's about owning it. So, when you're involved in treatment planning, you're doing much more than setting goals. You're ensuring that your decisions are informed, that your mental capacity is respected, and that you have the autonomy to steer your own course in therapy. This is why being engaged in the treatment planning process is so vital. It helps you take control of your journey in a way that feels empowering, safe, and aligned with your values. Remember, therapy is a partnership, but ultimately you're in the driver's seat. I will be there to guide and support you, but your voice, your consent, and your understanding are the foundation of this process. Don't hesitate to ask questions or express concerns. You deserve to feel empowered in making decisions about your mental health and well-being. You can subscribe to my channel if you don't want to miss any new public content I create, and you would like to stay current with new content from my clients. I hope this has helped answer your question. Remember, therapy is about you, your growth, your healing, and your well-being. If you ever feel uncertain about the treatment plan or your role in it, don't hesitate to talk to me. Your voice matters, and the best outcomes come from working together. Thanks for watching, and take good care of yourself.